Hi, I'm Dr. Stephen Olmos, and I want to welcome you to this week's edition of Ask Dr. Olmos. Today's question is the only treatment for sleep apnea CPAP, or can I use an oral appliance? Well, there's a lot of questions that have to be asked, and examination needs to be done to be able to answer that question. A lot of factors are how severe the apnea is. Some people stop breathing every 30 seconds. Some people only stop breathing 5 or 7, per hour. If an adult stops breathing more than 5 times an hour, stops breathing, or their oxygen levels drop by 3 to 4%, more than 5 times an hour, then a positive pressure machine like a CPAP or a BiPAP, which has 2 levels, or an APAP, which is an auto-adjusting pressure for people. Any one of these positive pressure devices is usually prescribed for people who have breathing issues greater than 5 per hour, and so very often people have difficulty tolerating because initially the air is to be pumped up through the nose and then down the throat. But sometimes people have nasal obstruction, and very often the sleep physicians who are diagnosing the person with this breathing disorders rarely take an x-ray, so they don't know if people have nasal blockage. So when they try to blow air up their nose, it isn't successful, and so then they go to a face mask and they blow air through the mouth. Well, sometimes that's an issue for people because of claustrophobia or just being uncomfortable. So that's why we have to take imaging to find out what are the obstructions that you have. If a person's been diagnosed with obstructive sleep apnea, they should be screened for what part of their airway is. And there's 4 parts that would be obstructed. So the nasal valve can be one, the nasopharyngeal area can be another, what we call the velopharynx at the back of the throat where your uvula is and the soft palate, and then right at the base of the tongue, the oropharynx. So all of those have to be open for a person to breathe normally, and that's why identifying it. Sometimes the people can use an oral appliance for that type of treatment. I'm able to do that, and works beautifully. After my nasal surgery, now I can breathe through my nose. I have just keep my throat open with a device that prevents my jaw and my tongue from falling back. Sometimes dentists make appliances for people, but it's just for the jaw. They don't do anything for the tongue. So the jaw doesn't fall back, but the tongue can still fall back. So you have to really look at all of the avenues and to manage it. So the nose has to be open, the throat has to be open. And then there's some people whose apnea is so bad, and sometimes they have arthritis too in their jaw. So we have to make what's called a hybrid appliance. So we use a device, a little mouthpiece that then holds the nasal delivery, so people don't have to have straps on their head. Most people who wear CPAP have it strapped on their head, but with this device they just bite into it and it holds the little prongs, but also keeps the throat open. So there's people who just can't tolerate CPAP because the pressure is so high that it's unnerving to them. But when you combine these 2 techniques, very often we're able to get the pressure down to 4 centimeters, which is the lowest setting on some of these units. And so it's very comfortable if air is flowing at a much reasonable rate. It's not so disturbing. You don't feel like you've been inflated. So combinations, and there's all sorts of techniques that can be utilized to make sure that you sleep and breathe comfortably and properly. And the only way to know is with examination. Thank you.